A sport that's exploded in popularity among adults and one that doctors are attributing major health benefits to is also resulting in increased injuries across the country. In this month's Eye on Health, WSBT 22's Anne Laree is looking at pickleball and how to play it safely.
48.3 million adults in the U.S. are hitting pickleball courts, according to the Association of Pickleball Professionals. That's 19% of the total adult population. And with seemingly more and more Americans out serving up aces and working on their backhand, that means more injuries. In part, what's contributing to that is the game's demographic.
There was a study published by the American Academy of Orthopedic Surgeons in September of last year where they looked at ER data across the country over several years for patients that presented to the ER with a pickleball injury, and about 90% of those patients from that data were age 50 and older.
Those injuries include springs and strains like in a wrist or ankle. There's also the aggravation of chronic injuries like arthritic pain and tendinitis of the elbow or shoulder. There are also injuries to the lower leg like a calf injury or tear, as was the case for pickleball player Klute.
It was my turn to receive serve, so as the serve comes, I step up, and just as I do, my right Achilles ruptures, and I'm laying on the ground.
It's a story becoming all too common. Adults similar to Klute who enjoyed sports like tennis years ago, looking to get back out and try something new, and maybe even a little easier, only to be injured early on.
Well, the biggest thing is, when I was playing tennis, I was 22 years old. When I was playing pickleball, I was 60. And I was walking with my dog a lot, getting steps in, but that's not even close to what was going on here.
Dr. Daugherty says while pickleball is a great sport that's adaptable to all ages and lifestyles, when someone is new to the game, they need to ease themselves into it. He says the nature of it brings a lot of starts and stops, running forward and backward to get the ball, putting a lot of stress or strain on the tendons and ligaments of the lower leg. Stories like Klute's seen time and time again by Tom Henry, a physical therapist. Henry says the problem for many is that they aren't active throughout the week and often get out and play on the weekends. They're often called weekend warriors, and it's an issue for anyone looking to play any sport. Henry says the best way to ensure you can enjoy sports like pickleball on the weekend without getting hurt is to stay on top of your health all week long.
One great way to prepare is just to do strength training. Also to get some better flexibility maybe of your upper and lower body. Maybe balance, something that involves balance.
Henry also recommends doing a warm-up with movements like lunges just before playing to reduce the chance of injury. But if you are hurt, he says some ice and gentle movements will help in your recovery and possibly get you back on the court. Like Klute, whose injury luckily didn't require surgery, and now he's back out walking his dog again and getting back into shape, with a message for others looking to get into the game.
The court's quite a bit smaller than tennis, plus I was playing doubles, and it looks a lot easier and a lot less, or a lot more relaxing than it really is. Take your time. Expect it's going to be a while till you get up to where you are competitive, and stretch.
For this month's Eye on Health, I'm Anne Laree, WSBT 22.